Kendall Keeter is a mom to two little girls, ages 8 and 4. She's certified as an International Board Certified Lactation Consultant, IBCLC. She got that certification in 2023 after 2.5 years of working towards it. She helps with all kinds of feeding challenges, but most commonly oral function related to tension and ties. And so we're really happy to have Kendall here this morning.
I'm really excited to be here.
Awesome. We're so happy to have you. All right. Well, we'll go ahead and get started just with telling us how an IBCLC can support both parents in the prenatal period first, and then how you may support a parent after birth when baby is little.
Yeah. So I love when families come to see prenatally, even if they feel very confident about breastfeeding, but even just to go ahead and establish care, kind of get an idea of their goals and some, problems that they are expecting to come up if they have complications to their pregnancy or their doctor is thinking that we need to prep for a NICU stay or something like that. We can kind of tailor their plan more specifically than, what a typical breastfeeding class will go over. So I really like seeing families prenatally. We usually will try and do at least one prenatal visit with families if we can. Sometimes we'll see people twice if, closer to delivery, they're like, "Hey, my whole birth plan has changed. Um, we need to talk through a whole new plan." Sometimes we'll do that. Um, so prenatal visits are very education and anticipatory guidance heavy, a little bit more one-on-one specific. I still recommend that people take a breastfeeding class in addition, but I think that's really helpful. Postpartum, the visits can kind of look all over the place depending on each family's individual goals and situation. I see most families probably within the first week of delivery. Usually, once they're home from the hospital and get settled, they'll give us a call. Um, and then most of the visits take place within the first 6 weeks. And then I usually see people around the time that um, planning to go back to work, starting solids, whenever we're ready to dry milk supply. If we decide to switch from latching to exclusive pumping, or if we've got any problems going on, I'll typically see people sporadically throughout the whole first year. Very occasionally, I'll get babies in the second year that, maybe are not ready to wean, but mom is ready to wean. I've had some older babies too, but majority is within that earlier postpartum period.
Okay, great. Makes sense. So you mentioned taking a prenatal breastfeeding class. Where is the best avenue to find those?
Yeah, so if you can find a lactation consultant in your area that does group classes, those are usually my favorite routes to go. Places like Aeroflow will offer like virtuals, but it does count towards your insurance covered visits. So if your plan has a limited number of visits, it may eat up all your visits. So checking through that to see if that's going to count towards that if your plan has a limit. Um, a lot of hospitals will have breastfeeding education. Sometimes WIC offices will. Um, some will even partner up with like dietitians and do infant nutrition and toddler nutrition all in one. But finding those local resources is usually going to be the most tailored to what you have in your area too.
Okay, great. I think those are a great idea too because it can help mom build some community before birth as
Yes.
well. And
Yeah.
that's good to know. I didn't know that some WIC offices do that. So that'd be a
Mhm.
great thing for our folks to look into.
Yeah.
Very cool. Okay. Okay, so we kind of went over this a little bit, but when is the best time that a parent should reach out to an IBCLC?
Yeah, I love whenever a family can reach out prenatally to go ahead and establish care. Um, Depending on what consultant is available in your area, they may have limited initial visit availability. So if you're already established with care, sometimes those postpartum visits are a little easier to get into. Um, and then anytime anything hurts, anything just doesn't seem comfortable or effective, or something just seems off, usually I'm like, just go ahead and check in. It may be something simple that's easily fixed. Um, I also tell my families, if you just even need some peace of mind, come on in and we'll, if we do a weighted feed or something like that, and that just makes you feel more settled, then I think it's a good time to reach out to.
Absolutely. How does your work differ from medical care that families may already be receiving?
Yeah, so as a lactation consultant, my job is one of the only ones on the medical team that cares for both mom and baby. So a lot of the specialties will care for one or the other and may have a little bit of knowledge on whichever one is not their specialty. But mine kind of bridges the gap. So um, I see moms more frequently in the first 6 weeks, where their OB may only see them at delivery, maybe for a wound check at 2 weeks, and then at 6 weeks to clear them. Um, Same with pediatricians. Sometimes I'm seeing in between the regular span of pediatrician visits. So sometimes just bridging that gap is helpful. Um, and then because I'm seeing people kind of in the in between, I get to see parents for longer periods usually too. So more continued care for longer appointments. So instead of like a quick 10, 15 minutes in and out, sometimes they're spending 60 to 90 minutes with me. And so that can be a little bit different. Um, yeah, I think that's probably the main
Yeah.
difference.
Yeah, I love that like you can bridge that gap and that you're, serving both mom and baby because like you said, a lot of providers are one or the other. And so I feel like lactation consultants have a really good like broad picture of what's going on. So it's very
Yeah,
cool.
yeah.
And I'm
And
sure you see lots of things that are like intertwined because of
yeah,
that as well.
yes, especially things when it comes to like we screen for postpartum depression and even further at the practice I'm at, we screen for postpartum anxiety, postpartum OCD, food scarcity, substance abuse, all those things that maybe if they're only going to the pediatrician appointments, they may not get screened for those things. Most don't go to the OB after their 6 week checkup, and they may not feel like they need to go to their general practitioner until a year later. So bridging that gap is really helpful.
Yeah, absolutely. What's the difference between an IBCLC and then other types of breastfeeding or lactation support? Or you can even tell us about maybe the different places or, avenues you might find an IBCLC.
Yeah. So for IBCLC specifically, you'll most likely see private practice lactation consultants, um, in-hospital lactation consultants, and then maybe like breastfeeding medicine providers, which also usually hold IBCLC plus have the ability to diagnose and treat because they're also a physician or a nurse practitioner or something like that. Um, so within those things, are, breastfeeding medicine providers probably will see more of like the medical need, um, doing like lab work for low supply, helping with mastitis and thrush with medication management. Some will help us out if, mom has a new thyroid disorder and it's affecting her milk supply or something like that. They also help with the general, latching and positioning, but theirs is going to be more focused on that medical minded help. Your hospital IBCLCs are usually going to be really, really specialized in helping during those first few days. Some hospitals will have like a lactation clinic where people can continue to come in. Many don't, and so they're really making sure that you're prepared to go home, making sure that baby is, latching well and is stable enough to go home. And then private practice, which is what I'm most familiar with, is going to be the lactation consultants that kind of are helping with all those in between things. So you're stable enough to go home from the hospital. We don't really have like a big, medical concern going on, but maybe the latch isn't comfortable. Maybe, supplies doing something funky and there can't, we can't really see like a medical thing going on. Um, that's where private practice will kind of help out. And then within private practice, a lot of us will kind of develop different specialties. Some are really, really skilled with pumping, others with things like oral ties. Others are, great with helping to relactate if we've completely dried up supply previously. So sometimes we'll each have our own little specialty within private practice. Um, as far as like the different kinds of lactation support, IBCLC is going to be like your gold standard. Most of the time, in order to work in a hospital, you have to be an IBCLC and something else. Um, that is going to require 90 hours of lactation training. I believe it's 15 or 16 college health science classes, and then anywhere from 300 to 1,000 clinical hours, depending on which pathway you're doing, and if you have mentorship and things like that. And then you sit for a boards exam, and then you'll receive the credential if you pass. And the other types of breastfeeding support are there's some like stepping stone credentials, which could be like 45 to 90 hours of lactation training, and then whatever test or, thing that they're requiring. And then we even have things that are more volunteer based and like peer-to-peer support, which would be like La Leche League, Breastfeeding USA, Baby Cafe, things like that. And those are usually their requirements are that you've breastfed one of your own babies for at least a year. You've wanted to, look into some breastfeeding education, and then you're just helping peer-to-peer.
Okay, great. And when you talk about like the different specialties, maybe like oral ties or feeding difficulties or things like that, does that require extra like courses, or I guess like how would they find someone who might be more specialized in those issues if they arise?
Yeah, so there's not like a formal like credential for specializing in something like that. Most of the time, just checking out your lactation consultant's website, or I mean, just asking, if you say, "Hey, I'm having an issue with my pump. Do you have a lot of training in pumping?" Most of us, as an IBCLC, we have continuing education requirements, and so most of us will kind of focus those. Um, while we have some general requirements, there is some wiggle room, and so most of us will kind of direct that continued education towards the area that we're really passionate about. Um, so, I mean, every IBCLC should have some general base knowledge, but for the more, I would say, like the more difficult cases of things, looking for somebody that has done extensive training in that area is helpful.
All right, we'll go ahead and move on. So, how do you work alongside other professionals? So, maybe like some of these guys, nurses, home visitors, case managers, to help support that whole family well-being. Like, what does it look like to partner with some of these people?
Yeah, so in our area, we have a wide variety of different professionals that support postpartum families. And so some of it is just even making a phone call to make sure that, we're all in the loop on things. Making good referrals, especially I mean, I can't fix everything. So having open communication to be able to make good referrals if needed. Um, Kind of supporting where the family is. Everybody's situation is a little bit different. So, whatever their support system looks like and their support plan looks like postpartum, kind of trying to find where I can fit in and work along what's already working is usually really helpful. And then just making sure that everybody is safe. Because I spend a lot of time with families in like one sitting, 60 to 90 minutes usually. Sometimes they'll share, some things that maybe they can't get to in a 15-minute visit with their doctor, but, making sure that the lines of communication are open when need be, can be really helpful for making sure that their doctor is able to get them care that they need that's outside of my scope to help with.
Sure. Yeah, I think that's really great too because an IBCLC scope is so broad. But like you said, you can't fix everything. And
Right.
I think that you all have a great opportunity to be like, oh, actually, you told me this, and I know someone who can help with that. And so you all are a great bridge to connect with other providers.
Yeah.
Okay, so what are some of the most common challenges that you help families navigate? And we'll just say postpartum. What are some of the most common challenges?
Yeah. Gosh, I feel like there's a lot. So supply is going to be one of the biggest ones that people see me for. Sometimes that is primary, meaning that they're doing everything that they're supposed to, but the supply is just not where it's supposed to be at. Sometimes it's just perceived low supply. Sometimes it's, we haven't been emptying and, pulling milk out frequently and effectively. And those can all kind of be caused by several different things. So supply is going to be the biggest one that people will reach out for. Pain, either with the pump or with the latch, is usually going to, be a reason that somebody would call. Um, we get several families that maybe their baby has food allergies and mom is trying to figure out what it would look like going forward. Some will want to transition to formula. We help babies that are having difficulties with bottle feeding, even if it's fully formula in their bottle, we're happy to help with that. Um, we help moms prepare for going back to work, exclusive pumping. We help with preparing for weaning. We help with mastitis, thrush prevention, um, oral ties, latch pain. I'm thinking that that's probably the majority. I feel like the list could go on if I go down any of the rabbit holes.
Sure. Well, tell me specifically, just because I know, being a mom myself, of course, being on social media, being like in, the perinatal world, I feel like the tongue tie situation or just the oral ties is like it's coming up all over the place, right? And so, how would you all address or help a family address if you thought that that might be an issue for the baby?
Yeah, I always tell people we can't make a good assessment based on just a picture alone. And so I think a lot of people, they see a frenum and they get really scared. Um, and Frenims are normal. It's just when they're too tight, it's too restrictive that that's considered a tie. IBCLCs can't diagnose a tie, but we can make a referral to a provider that would assess and diagnose. Typically, when I see a family and we're concerned that maybe the tissue is restrictive, what we're going to look for is how does it function first. Sometimes it looks very pronounced, but it functions properly. It's very stretchy. Um, so we don't really care what it looks like. We want to know what it functions like. So, um, at my visits, I'll do a full oral function exam, kind of get an idea of can we hold a seal? Can we hold suction? Can we move in a peristaltic motion? Um, are we, breaking suction to breathe through our mouth? Things like that. Um, Assessing for latch pain and supply and frequency of mastitis and clogs. And then if we suspect that maybe some tissue is restrictive, I usually like to try and get a bodywork provider involved. Sometimes tissues look restrictive, but the muscles are just so tight that it just seems tighter than it actually is. Sometimes we work on the body and we get more range of motion. Sometimes we work on the body and we make a lot of improvement and then we still don't have the range of motion. And then I usually refer to a provider who can assess and release. But usually I usually tell families we don't want to rush to do something really invasive. It can be really helpful, even if we do need to go that route, if we take care of body tension first, make sure that baby's really comfortable in their body and that they've had some good practice at the breast um, or the bottle. We've had babies with ties that they struggle with bottle feeding. Um, but yeah, and that's pretty much my route. Sometimes we've had babies that are very severely tied, and we'll kind of chat with a release provider, and sometimes they'll say, "This is so tight, we can't really work on anything else because it's so restricted, we can't move." So we kind of take it case by case. I don't really have like a blanket step by step. Every baby's so different. I've had some where, you would think this baby was struggling really bad, but they had really good function, and others where it looks like nothing's going on, but they're struggling so bad. So our biggest concern is, if we do something invasive, would the baby then be so uncomfortable that they wouldn't feed well? So we want to make sure that they're set up to still feed well through that process if needed.
Mhm. What are some common misconceptions? I always love this question about everybody's field, right? What are some common misconceptions? What do people think about lactation consultants that's just not true?
Um, I think so. Even just in my office, sometimes with people that come in for the first time, I think that they expect that we're going to be really judgy and really pushy, and yelling breast is best at them if they if they're doing something different. But I mean, at least all the colleagues that I know, we're really whatever works best for your family and your baby is what we want to do. And we want to help you meet whatever your goals are. If your goal is 2 weeks, we want to help you get through 2 weeks very comfortably. If your goal is to switch to the bottle right away, we want to help you dry your supply comfortably. So I think that's the biggest thing is that we're going to be pushy or judgy or, not supportive if you don't want to do this anymore, that we're going to be disappointed if you decide to change your mind and you want to quit. We're not judgy at all. We just really want to help you do whatever it is that you want to do. We want to help you do it comfortably. Make sure you have all of the information, and help you from there.
Okay, I think we're going to get to this question later, but like, let's say a family didn't want to breastfeed. What are some other things that they may come to you all for?
Yeah, so drying supply, I've had some that have seen me the day after they leave the hospital to help them with drying supply, bottle feeding, and then sometimes people will come see us if their baby, they think that bottle feeding is going really well and that the formula is fine, but baby's just really uncomfortable and gassy. So sometimes they'll come see us just for that oral function eval. And, sometimes we're making a referral to the better suited provider for them. Sometimes it's, just maybe switch up the bottle and see if that helps. Sometimes outside of breastfeeding, we'll see people for that. I've also had people that didn't want to breastfeed and then a few months down the road change their mind and now they do. And so then we'll help with relactating and or inducing a supply. I've had a couple adoptive moms that have wanted to induce lactation from like they haven't lactated before and we've induced it. So kind of varies.
Gotcha. Yeah, I think that makes sense too, as far as like the bottle usage, right? You say like you get some babies who might have colic symptoms, and finding that bottle that like the baby will tolerate. That's something that my family didn't know. Like it doesn't come with an instruction of how to use the bottle. Make sure the vent hole's on the top. Make sure, like sometimes, again, new parents are so stressed out. They need to be, taught some of those things. So that's a great opportunity also outside
Yeah.
breastfeeding to really help support mom.
Yeah.
Very cool. So, what have your clients said are the benefits of working with you or just an IBCLC? What's good about it?
Oh, man. So I think for me, I always feel really good when a client says that they felt really heard. When, somebody just sat and listened. I've had some that have said nobody believed me. I felt like I was crazy. I knew something wasn't right with the latch or, something was going on. And so I think one of the benefits is just that time that you're able to spend and really dive deep with somebody. You can get a really full picture of what's going on. Um, I've had several that have said that they just feel peace of mind coming in every so often, and being able to weigh the baby at our appointments, just gives them peace of mind. Um, I think those are going to be the biggest benefits that, I mean, of course, people meeting their goals and things like that are great. But
Yeah. Yeah, I think it's great. You all have a very unique ability to, like you said, sit with someone for 45 to 60 minutes with baby just eating and maybe they want to talk about whatever. So it's great.
yeah.
It's an extra support. So, kind of along those same lines, what role do you think that you can play in supporting the mental health and like the confidence piece in that early parenthood?
Yeah, so a lot of people in our profession, we try to really encourage mom to listen to her body and listen to that little voice inside that tells you like what's going on with baby. Um, I usually tell people like, hey, you might not have the words for what's going on, but if something feels wrong, don't feel like you have to suppress that. Let's talk it out and let's see. A lot of times moms are right when they think something's wrong. They may not know what's wrong, but they know their baby. And so I think I say that during every appointment. I'm like, your baby. I see you for maybe 2 hours in a month, but you're the one that's home with your baby all day, every day. You know your baby. If something's wrong, I believe you. Um, and I think sometimes even just that of instilling that confidence that she does know her baby. And they're both figuring it out, and that's normal, and everything is not what you see on social media. And I think I say that all the time to him, like, you're normal. This is, you know, you're not abnormal for feeling this way or for being overwhelmed by this. It's overwhelming. And sometimes even that helps. For mental health specifically, I know at the practice I'm at, like I said, we screen for postpartum depression, postpartum anxiety, postpartum OCD, domestic violence, uh, food insecurity, substance abuse. There's, oh, safe sleep as well. And so we kind of, we'll go over it with them. Obviously, my role in that situation would then to make a good referral, get them connected with some local mental health support resources, reach out to their doctor if needed, if something's unsafe. Um, but kind of able to check in frequently also kind of helps paint that picture of, okay, we started out okay, and now our scores are getting higher and higher. Maybe we're not quite over the threshold, but things maybe are not progressing to a point of everything settling. And so we can also help them get help quicker, um, versus waiting and, saying, oh, well, it's been a few weeks. Maybe this is just a one-off score. But if we see those trends trending upward, yeah, I usually I make a lot of good referrals in the area for some are like, I really want to go to therapy, but I can't go to a visit or something. So even finding support that will be virtual or that takes their insurance, or just helping them get connected. Sometimes with postpartum, and I'm sure you know this as a mom, that everything feels very overwhelming, and it's sometimes just taking that little something off their plate of like, hey, I'm giving you this list. I'm going to reach out to your doctor for you. We're going to get you the care that you need. Um, Sometimes that feels less overwhelming than, here, go find some help. Go find that. It's like takes that little bit off, makes it a little easier.
Sure. And I think that you all are seeing so many families postpartum too, that you can probably gauge a little bit better than the general population of like, is this mom doing okay?
Yeah.
Or, does she need some extra support? And so,
Yes.
um, that's a great opportunity.
Yeah. Sometimes in those, baby gets latched and we're sitting together, sometimes 30 minutes while baby's eating and we're just sitting. Um, and, I may be the first adult that she's talked to in weeks, and I
Yeah.
may be the first person in a while that said, like, how are you doing? How are you feeling?
Yeah.
And so sometimes just giving them that space to say, I'm not doing well. Um, I remember being postpartum and I would go to the doctors and I'd be like, everything's fine. I'm fine. We're all good. And really on the inside, I was like, I'm not good, but I couldn't unpack it in a 15-minute, in and out appointment.
Okay, so feeding and just general baby care and postpartum care can be culturally different. And so, how do you tailor your support for, diverse needs or family structures, languages, cultural preferences around things like feeding and safe sleep?
Yeah. So this can be so very varied, so wide. Before I started doing this, I had no idea uh, that the way that I, did sleep and solids and all that, I didn't even realize that that was kind of cultural. As an IBCLC, we are required to do diversity and ethics training. And it's interesting when you talk to even just lactation consultants in different cultures, because it is an international certification, just kind of how different areas will navigate different things. So my main thing is whenever I'm with a family, I just want to meet them where they are. I don't want to assume that I know more just because my way that I did things with my own family was one way. Um, some things are have very deep cultural context, and so to say, oh, your whole culture is doing this wrong because this is what my textbook says, I feel like that's irresponsible and really hurtful. And I can't assume that I know everything. I do see that some families with different religious backgrounds or different cultural backgrounds will tackle things like sleep differently. the way that they value postpartum support in general may be different. I've walked into uh, support with a family where, mom needed to stay in bed culturally. She was not supposed to be up and moving around. And so coming to the office was not an option for her. Um, I've had some families, where because mom has postpartum bleeding going on, she couldn't hand the baby to dad. And so, kind of trying to just be really open and ask and not assume, that, that I know everything, and just asking all along the way, how I can be fitting into their routine and their rhythm as it is.
Yeah, absolutely. Like that's a really good perspective to have. And like you said, it's hard to even realize, what you do with your own babies is because of your family culture or your,
Yes.
heritage culture or whatever. And you're like, oh, not everyone does it this way. And so I'm sure you have a really unique experience to be able to see lots of different things.
Yeah.
Um, and like take those things and teach other people like, hey, I know, this person does it
Yeah.
this way and that might work out better. So I'm sure you have a very unique lens on that. It's cool.
Yeah, I think the most interesting one that I've come across is when it comes to like religious fasting, and some religions will still expect moms to fast, and some will say that they're exempt. And if you read a lactation textbook, it's like no. But so usually I'm like, this is the information that I have. I think, we should talk to your spiritual leader and kind of talk through, and so some of it is just I can give you the information I have, but I'm not going to give it to you in a judgmental way. um I want everybody to be safe and have information, but at the end of the day, it's their postpartum experience, their religion, their baby, their family. And so you know giving information but not telling people what to do.
Yeah, and having that opportunity to give that information from a place of care too, like I don't want you to pass out because you haven't had any calories
Yeah.
today, or I don't want you to be dehydrated and end up in the hospital unable to care for your baby or things like that. And just
Yes.
presenting it in that way, I think is,
Mhm.
so special. All right. So this is a big one, right? What are some barriers that families may face in being able to access types of lactation care, and how can our providers and just the general public help to try to reduce them?
Yeah, I think so. Some of the barriers are going to be those misconceptions about what we can help with, and what support looks like. Um, some of it, depending on area, could be even just there may not be any around. Many lactation consultants nowadays will do lots of virtual. COVID gave many of us tons of experience doing virtual appointments. There are fully virtual lactation clinics. The other thing I think is going to be a barrier is lactation coverage with insurance. Um, some plans it's really hard for IBCLCs to get in network with unless they have another certification. Others, it's a really long process. Some plans, even if we're in network, they may say they don't cover the codes, or they'll say we'll only cover the codes if it's this provider who also has this credential. So there can be a lot of variation because it is more of a general scope of practice. I've come across some that said that they'll cover lactation for mom, but not for baby, or um, so I think that's the biggest things. Um, many lactation consultants will have some kind of self-pay plan, um, but that's obviously not accessible for a lot of people. Um, TennCare is really hard to get in network with, and the reimbursement rates are pretty low. So some are like, it's
Mhm.
going to take a year to get in network. It may take, 4 months to get paid for the visit. So some will kind of have limited TennCare visits where they won't be able to get in network with TennCare at all, which then just leaves self-pay as the option. Um, I think that while there's benefits to having specialized support, sometimes even just opening up, maybe like a support group for moms to talk through things with each other, maybe even, I know a lot of the consultants that I know will attend the support groups and do what we can, um, without it being like a one-on-one appointment type thing. Some will try to do that. But I think those are the biggest things.
Okay, awesome. And I know you talked earlier about some of those other like resources that are, adjacent to what you do. You mentioned La Leche League.
Mhm.
Tell us a little bit about the Tennessee Breastfeeding Hotline.
Yeah, Tennessee Breastfeeding Hotline is great because you can call, it's available 24/7. I usually tell people this resource is great if you need an answer to a question and you can't really wait for your lactation consultant to reach out. If you start having like, a clogged duct and it's 3 a.m. and you're like, what do I do? It's a really great resource for that. Um, and can kind of help bridge the gap between your lactation appointments or help out with that acute care stuff. It is over the phone, so some things are going to be a little bit hard because you're literally just describing what's
Yeah.
going on. But it's very, very helpful. It's free. Um, so sometimes that can make a big difference in, taking care of things early before you're too uncomfortable. Um, we usually recommend it to our patients for after hours questions. If you need something over the weekend, at least to get you through until we can see you next.
Mhm. Absolutely. And I really liked your idea about connecting moms to like a breastfeeding support group as well. Again, even if they don't have that access to, an IBCLC, maybe there's someone who can have some type of experience that may be, similar to what they've had. And so that even if, our organizations aren't able to offer their own breastfeeding support group, they could get them connected to someone at La Leche League. Kira says, would they be able to speak to someone in Spanish in that hotline? It looks like their services are available directly in Spanish, French, Arabic, and Mandarin. Very cool. So yeah, that's great. That's an awesome resource. And I'll send that out this afternoon when I send you all the follow-up stuff as a resource too.
Mhm.
Um, I can send the stuff for La Leche League too. I believe they have like a map of where it's very statewide from what I understand, Kendall. Is that correct?
Yeah. So La Leche League has La Leche League USA and La Leche League International. So technically two different organizations, but very much aligned. And it's a nonprofit. It's all the groups are like peer-to-peer support. They have at their meetings, they'll have like a curriculum and like an order of what they're talking through in the weeks. And then, moms can come. They really encourage everybody if you're there, feel free to breastfeed while you're there. They believe a lot of we learn a lot by seeing and by supporting each other in that way too. So there's the Leche League, there's Breastfeeding USA, Baby Cafe that I can think of that kind of do that support group type structure. Um, and La Leche League's websites also have tons of, you know, resources, articles about just about anything you can think of. They have two books that I usually tell people to, new moms or while you're pregnant, kind of read through. It's going to give you more of like, the crash course in breastfeeding type stuff. But they should have an interactive map on there on how to find a group near you. Some will do virtual groups. I was a Leche League leader before I was an IBCLC, so that one I'm much more familiar with. But yeah, they'll do virtual support groups, in person. Sometimes they'll have groups will have multiple cycles of groups going at once in different areas in their region. But it's great.
Awesome. And I did just look them up. I'll add that to the list as well. And they do have a Spanish Facebook group
Yeah.
page also for that. So that's great.
Yes, usually it's Leche League leaders adminning the Facebook groups. They also have a direct line you can call the Leche League and they'll get you connected with a leader for peer-to-peer support if you need something like ASAP. Um, Usually you'll like put in your request and someone will call you as soon as someone's available. But really, really helpful for that too.
Okay, great. And then there were two other resources that I wanted to make mention of that you sent me, Kendall. One you mentioned earlier talking with families about allergies.
Yeah.
And so do you want to tell us a little bit about that resource?
Yeah, so a lot of the infant allergy resources previously available were based on formula. So the one that I sent you is called Free to Feed, and the creator is a allergy research scientist specifically for breast milk. So she shares things on there about like how long an allergen protein stays in the milk. She has a whole resource of like poopy diapers and how to kind of gauge, okay, is this normal? Is this a reaction? Um, she does do like one-on-one consults if you're having a hard time, but I like her website because it also has some really good swaps for like different foods. If you've cut out dairy and soy, here's some different things that you can try in your diet instead. In those situations, I always recommend working with a mental health provider and a nutritionist. Um, but in the meantime, like while you're grocery shopping, if you're like, what can I eat? You can kind of look through that list of brands that are safe. She's got research on like teaching you how to read an allergy label on the ingredients list, um, kind of talking through elimination diets and how to reintroduce things back into your diet. Very diverse. And then she even has information of, okay, if you've decided that it is too hard to eliminate all these things from your diet, these are the kinds of formulas that you can check in with. Um, Sometimes your pediatrician will recommend seeing a GI, but it's not always the case depending on where you're at and which pediatrician you see. So it can at least get you through until you're able to get in with a GI if that's part of your pediatrician's plan.
Sure. Yeah. Well, and that like ends up adding so much stress to a new mom too, right? Like you got to be careful what you eat. Don't eat this. Don't eat that. And then it makes us, does the baby cry more when I eat milk or when I don't? And so, yeah, that ends up being a tough rabbit hole too. So,
Yes.
if you're waiting for, 2 to 3 months to get into a GI, like you said, it's at least a good resource to be like, okay, here's some like
Mhm.
standards of care
Yeah.
to look through. Okay, awesome. Well, that was all the pre-selected questions that we had, just that you and I talked about for FAQs. I'm going to go ahead and open the chat and the floor for anyone to come off mute and ask Kendall any questions that you may have about lactation, just general resources, ideas, or troubleshooting, anything that you all have. Or I just did such a good job asking a million questions that no one has any. No, just kidding. Um, I'm the question queen sometimes. So,
You did put really good questions on there. They really I was like, man, I've never thought about that before. That's great.
you know, being a mom, becoming a new mom this year and just learning all the things that you have to think about, it's like it does make you come up with like, oh, I had this question, I had that question. So,
Yep.
um, someone's asked it, before.
Yes.
Oh, Carla. Okay, Carla has a question. How many different ways is there to stop lactation, and which one do you think is best? That's a good question.
Oh yeah. So, I mean, there's the option of using medication. We've had some families that need to do that for medical purposes. They need to stop lactation quickly. Um, that would be prescribed by your doctor. Um, we could do like the really, you know, cabbage leaves in a tight sports bra, trying really hard not to stimulate lactation and let it dry up that way. If I have somebody that's been pumping or latching for a while, typically we want to try and find a way to do so slowly so that we don't cause clogs, mastitis, things like that. So that may look like changing up the schedule, changing up the routine of each individual pump. Um, Yeah, sometimes we'll use things like cabbage cream. Like if, I have a mom that wants to dry supply because her toddler just will not wean. Sometimes we'll use cabbage cream so that the supply is drying and then toddlers are like, oh, this is not what it used to be, and supply is decreasing on its own. So it kind of varies person to person. I usually think whatever is best is going to be what's most comfortable for mom.
That makes sense. Well, and I'm sure that, like you said, it can vary person to person because what you also don't want is like mom's trying to dry supply. She may have to go back to work. She's going to put baby on formula. You don't want her missing work because she's got mastitis or clogged ducts, and then she gets sick and then has to take more time away from baby and work to go to urgent care or,
Yes.
you know, those types of things. So, great question, Carla. Okay, Debbie says my microphone's not working, but I'd like to know more about virtual support groups. Kendall, any other avenues that you can think of for that?
Yeah, I mean, some lactation consultants or some that have like those stepping stone certifications may host their own and kind of have their own plan and curriculum for those. Um, I know with La Leche League, we would kind of follow, I think there was like 4 or 5 different meetings that we would go through. It's been a while, so that may have changed. But basically, you'd have a topic, and then, you'd kind of talk through the education of that, and then you'd open the floor for discussion. So some will just meet right on Zoom. It'll probably vary group to group. A lot of the La Leche leagues do virtual, though, I know for sure. Um, but I would check in with the consultants that are closest to you and see if they have any that they host. If not virtual, they may have a different option, in person or a recommendation.
That makes sense. Well, and that even brings up something else that I was just thinking of when you said, like, getting your clinical hours or like your contact hours for your certification. That may be another good route for people to get access to that care without, having to maybe, bill insurance or things like that if someone needs more clinical hours. So that's
Yeah.
another good route.
Yes. So the clinic that I was at previously and the clinic I'm at now, usually we've always had like 1 or 2 students that, they've done their stepping stone certification. Some of those will let you bill insurance depending, I think CLC will, depending on the insurance company and your supervision or, variables like that. But most of the time, some clinics will even have students and they'll be the ones hosting free support groups or um, they may have a really, really discounted rate if you're willing to see a student instead of the IBCLC. During those clinical hours, depending on where they are in their number of hours, usually an IBCLC still has to be on site. So if something is like terrible outside of, what they feel confident handling, somebody should be available to step in and help if needed. But those are great. Uh, for my own clinical hours, it was during COVID, so a lot were done virtually at the time. So sometimes, maybe you don't need a full appointment. Maybe you've just got a couple questions or, need help troubleshooting how to do a certain position or something. Um, that may be an option for sure.
Yeah, that's a great idea for accessing that care,
Mm,
even if you don't have the insurance or, cash to pay or whatever. So it's
yes.
great. Good idea. Okay, any other questions? All right. Well, if anything comes up too, you all are free to respond to my email later. We know where Kendall is. We can find her and she can answer our questions.
Absolutely.
Um, and make sure that you all are able to help your people get the best care that you can get them. So I hope that this has been informative for you all and that you've learned a little bit about just another avenue to support families and maybe some ideas and ways to connect them. We will talk to you all soon. Have a great weekend.